Hi guys. In this case, we have a gentleman with severe abdominal pain. Right off the bat, we do see that there's pleural effusion on both sides with atelectasis of both lung bases. This shiny thing in the superior, this is the superior vena cava, is probably just some central venous catheter um, terminating out here. Um, in the heart, the pericardium looks okay. Let's just quickly scroll down. The biliary ducts are slightly prominent. There is ascites around the liver, there's ascites around the spleen. As I scroll down, now in this region, there's a lot of inflammatory fatty stranding. And if I look at the pancreas, here the pancreatic tail is enhancing normally. Right around here, it's not enhancing as well. And right from this point across, the pancreas is not enhancing at all. And right down here, a little bit of the uncinate process is enhancing okay. So with all these inflammatory fatty stranding around the pancreas, um, a chunk of the pancreas not enhancing. This is a case of necrotizing pancreatitis. Now let's take a look if this person has gallstones that we can see. Um, not really. So CT can miss non-calcified gallstones. Ultrasound is much more sensitive, but at least we don't see much. There is some fatty stranding around the gallbladder, but I would say this is reactive from the pancreatitis as opposed to acute cholecystitis. Let's take a look at the bile ducts. So here's my common hepatic duct. I don't know where the cystic duct comes in, kind of hard to see. This reason my common bile duct, it's taking this course. I don't see a stone in here. Again, CT is not the most sensitive thing, but I didn't see any evidence of gallstone pancreatitis. Let's go back to my axial images again. So we looked at the pancreas. Now let's take a look at the vessels. Um, so our portal vein, follow it down. This is our splenic vein, and right in the splenic vein, we do see a fitting defect. So there's a non-occlusive thrombus in the splenic vein. Let's go down to the superior mesenteric vein, and there may be a thrombus there. So that's the splenic vein thrombus that we saw before, right there in the superior mesenteric vein. There probably, I think there's a thrombus right there. So non-occlusive thrombus there. Let's take a look at the arteries, celiac trunk, giving out the common hepatic artery. This is the gastroduodenal artery. This would be the hepatic artery proper, giving the left and the right hepatic arteries. Splenic artery right there. The superior mesenteric artery right here. Where's the inferior mesenteric artery? Let's see. It's coming right off here. A renal vein. Other renal vein. Okay, let me go down quickly. So that's that. There's ascites tracking down the right paracolic gutter here. There's more ascites down here in the pelvis. And at this point, I'd follow my source pattern, but this case is an acute necrotizing pancreatitis. They have some grading level based on the area that has been, rough area that has been necrosed. I don't know the grading on top of my head. And we do have, and let's see, other thing I wanted to point out was, I'm trying to see if there's any fluid collection walled off. There is fluid around. I don't see any loculated collections. Again, there's fluid down both paracolic gutters. There's fluid down here too, but I didn't see any walled off collection. And this is CT from 2 months later. And if I scroll down, the intrahepatic bile ducts are dilated abnormally. That's compared to here. There may have been some mild dilatation of the bile ducts. This low density stuff you see are the bile ducts, like right around here. This is much more prominent 2 months later. The gallbladder is still here. The extrahepatic bile ducts are really dilated too, and it's really narrowed down as it goes closer to the duodenum. And there's this big fluid collection. So that again, that is terminologies that if someone has necrotizing pancreatitis and it's been more than 4 weeks and there's a collection, then you call it a wall of necrosis. So this is big wall of necrosis right here. The pancreatic duct in the tail is dilated. Who knows, maybe this duct is emptying out into this collection. And then the other thing that I noticed was that there's this vessel that kind of goes in through the collection itself. And if I follow it back, it's coming from here. So this is celiac trunk, common hepatic artery, and this is the gastroduodenal artery. So the branches of the gastroduodenal artery are going right through the collection itself. And let's look at our vein. So portal vein is patent here. It's really compressed here. Splenic vein is compressed here. Do I see a thrombus in the splenic vein? Not convincing. There could be a tiny one here, but if I go down more, let's see. If I go down more, right here in the superior mesenteric vein, I think there's a thrombus. Let's see, where did I see that? So you can see the mass effect this collection has on the portal vein. It's really compressed here. And if I come down more, if I come down more, I think it was around here. Let's see. I'm not really 100% convinced that there's a thrombus here. Let me look at a cheat sheet to see what other things I was supposed to find out. So there's a pulmonary embolism here on the initial presentation. If I follow the pulmonary artery out here, there's a pulmonary embolism. Superior mesenteric vein, we saw that. Splenic vein, we saw that. Acute necrotic collection. I guess those are probably maybe somewhere around here. There's all this fluid around here too. Let's see, on the 2 month later, we do see this wall of necrosis. Yeah, so these are the findings. Thanks for watching my video.